For the past year, we have been healing together
It's the biggest part of my sobriety today, staying busy and helping others.
to find a solution to addiction
It is so powerful. It's going to kill you.
and offering hope to those who need a second chance.
Pray to God that something happened.
Join ABC 6 News as we examine the real story of addiction. Healing Together, a special On Your Side presentation, sponsored by the Ohio Opioid Education Alliance and Community for New Direction.
Hi, I'm Adam Slinger, and welcome to a special presentation from ABC 6 News, Healing Together. For the next half hour, we will show you the progress we are all making in the fight against addiction. Now, these stories are sometimes painful, but they are also inspiring. As Jackie Orozco tells us, addiction is everywhere.
It is so powerful. It's going to kill you. It's killing everybody. You know, I don't have another one in me. If I was to go out, I would die.
Sherry Baisden has been in and out of jail for more than 24 times. She's a human trafficking survivor and is a recovering addict.
It got to the point where I had to take it to function normal.
Baisden says since she was young, things were rough.
When I was younger, I was sexually molested by my grandfather. I was in 16 foster homes because I would not stay put.
She became a young mom and soon after married, but her marriage fell apart and so did her world.
When I would take a pill, it would make me forget. It would make me forget, you know, the pain and the thoughts. Like I didn't feel anything.
That's why opioids are so dangerous. Dr. Christiana Deppen with Ohio Health explains.
People develop a physical tolerance and dependence, and when they stop using, they develop pretty severe withdrawal, which keeps people continuing to use. Even when they're not getting high, they're just trying to not be sick.
You get the sweats, the need, the wants, you know, and a lot of times the women are addicted to the lifestyle.
Today, Baisden is 5 years sober, but it's not easy.
Once you're an addict, you're always an addict.
Dr. Deppen says that's why many relapse.
Once somebody has an opiate use disorder, that is something that they're likely to need to manage in some way for the rest of their life. This is a chronic medical condition, just like, you know, diabetes or heart disease.
Dr. Deppen says treatment and prevention are key. That's exactly what Baisden is doing.
Reach out because there's always somebody on the other end to help you.
Living a new life with her family, especially with her grandchildren. In Columbus, Jackie Orozco, ABC 6 News.
Mental health is something more of us are willing to talk about every day with friends, family, and coworkers, and we can thank teenagers for leading us in this conversation.
Meet Sherrod.
COVID with isolation, it's been very traumatic for many people.
Joy.
Try to stay healthy, like go for a walk or work out.
Esma.
I see you guys as like friends, not members.
And other high school students across Franklin County. They're part of the Franklin County Youth Council. Since the pandemic, they've been meeting virtually almost every day, talking about drug abuse, stress, and other mental health issues.
Stress from school, not being able to go to school physically has really been hard because I'm a hands-on learner.
The goal is simple.
They're so passionate about their work, they're motivated, and they're really fulfilling the mission of the council, and that is to amplify youth voices. They have made it possible to engage other youth so that, one, they understand that whatever they're going through, they're not alone, first of all, and that it's okay to talk about it.
The council was created in 2013 after the Sandy Hook shooting, an initiative to engage young people to talk about addressing mental health issues among their peers. And with the help of several local organizations, they're voicing their concerns.
They're having a health, mind, and body youth movement where they have invited and they actually reached out to their panelists. They have Judge Jameson from the juvenile justice system.
And potentially saving lives.
Yesterday, there was just an incident to where I actually had to pull someone aside and talk to them and say, like, I'm here for you. Like, and you're not like broken, like you're not wrong, like it's okay. And that like your mental health is very important and that this is just the start of your journey to get right back on track to being happy and to being yourself.
In Columbus, Jackie Orozco, ABC 6 News.
Mental health is just as important as your physical health. And we don't need to tell you that during this pandemic, feelings of depression and anxiety are high. That's why the Ohio Department of Mental Health started the Strive for 5 program. Jackie Orozco explains how it works.
Empty chairs, getting your temperature checked, and wearing masks. It's putting everyone on edge.
They're calling for things like wanting to talk about anxiety or depression.
Lori Chris is the director of Ohio Mental Health and Addiction Services. She says the crisis text line has doubled. In February, 500 calls and texts. In March this year, 400. She says we all need to take a deep breath because everything will be okay.
The best thing to do to help with anxiety is to use trusted sources of information, get the facts, know how to take control for yourself and your family of the things that you can control.
Her department also launched a COVID care line on April 22nd. In the first 4 hours of it launching, 150 calls came in.
The COVID care line is a free, confidential phone service where people can call this line and talk to a trained, licensed counselor or social worker who is able to just listen to what their concerns are, kind of coach them through them with some solutions, connect them to local resources.
Even the governor stressed the importance of taking care of our mental health during the pandemic in early April.
Mental health is truly just as important as physical health. It is part of our physical health.
The Ohio Department of Mental Health also launched the Strive for 5 campaign. The message, reach out to at least 5 people a day, whether it's through an email, phone call, text, Skype, or FaceTime. Anything to help people feel less isolated and less alone.
We're all in this together. This is a stressful time for everyone, and we each have a part to play. This is temporary, and we've done hard things before. We're doing them now, and we're going to come out on the other side.
In Columbus, Jackie Orozco, ABC 6 News.
More kids are now seeing their parents fall victim to addiction. And one popular TV show is trying to help children understand this problem. We are, of course, talking about Sesame Street. Once again, here's Jackie Orozco.
How come Carly's mommy had to go away?
Well, son, Carly's mommy has a kind of sickness.
Sesame Street is launching a new webinar series to discuss parental addiction. Sesame Street introduced a new Muppet named Carly, whose mother struggles with substance abuse and addiction. Child psychologist Dr. Parker Houston at Nationwide Children's Hospital says it's never too early to teach kids about substance abuse.
The characters are so relatable, and they put so much research and effort into making it digestible for kids at various ages. And
sickness? Like when Elmo has the sniffles?
Oh, no, it's not that kind of sickness.
But with the pandemic, schools are going virtual and sports, trips all canceled. So it's broken down family schedules, causing teens and young adults to turn to other addicting things.
Those are things like addictions to things like pornography and internet usage and gaming.
And when a parent is dealing with their own addiction, like substance abuse, it adds another layer of problems.
It also has caused some people to turn to substances as a way to pass the time.
According to the National Center on Substance Abuse and Child Welfare, almost 6 million children under the age of 11 are living with a parent who has a substance use disorder, putting those children at risk for direct and indirect trauma.
But why doesn't she just stop?
Oh, it's not something you can just stop doing, not without help from the right grown-ups.
If you'd like more information on how you can talk with your kids or learn more about the webinar series, go to our website, abc6onyourside.com. In the studio, Jackie Orozco, ABC 6 News.
Drugs could currently be in your home and you may not even know about it. It is shockingly easy for kids to get a hold of drugs, and there are new ways they are hiding them from you.
We're seeing a huge increase in the stimulants. Cocaine, seizures are at some of the all-time highs.
David is an undercover drug agent with the Franklin County Sheriff's Office. We're concealing his identity because he's on several active drug cases. He says his agents are out on the streets and online.
It's as easy as it was, just using the regular telephone, but it makes it harder for law enforcement to do enforcement, to try to track.
That's why he's part of Operation Street Smart, a free program educating parents in the community about the hot drugs going around and the household items to look out for to see if your kid is abusing drugs.
Obviously, it's used to scrub pots and get them nice and clean, but if someone is using crack cocaine, they'll use this as basically a filter for their crack pipe.
These undercover agents say kids are using social media apps to get their fix. It's even pouring into some schools, hiding and selling drugs to classmates in sneaky ways.
What the child had done is just take the eraser off, take the lead out, crushed up his Adderall pills and then put it down inside there.
Law enforcement is making huge strides in the opioid epidemic across Ohio. In 2018, drug overdose deaths were a little more than 3,500 across the state. That's about 1,000 fewer deaths than a year before. And it's the first decrease in 9 years. But that same year, in 2018, overdose deaths went up in Franklin County.
They are putting fentanyl in with the heroin, and then they're also selling fentanyl as heroin. So if you have an unsuspected user that is used to using a certain amount of heroin and it has fentanyl in it, especially one of the harder fentanyl analogs like carfentanil, and if they're not suspecting it, then it's much more easier to overdose.
Alicia Ramirez is seeing it firsthand.
We have to have that fear because we are exposed to that, very exposed to it.
She's a mother of 4 and attended Operation Street Smart.
And it is a concern to us because we are exposed to all these drugs.
Even though almost anyone can get anything these days with a click of a button, law enforcement says programs like this helps parents open their eyes on what's out there and educate their kids to stay away.
And I would tell them they have to think about their future.
Should you hear those words?
In Columbus, Jackie Orozco, ABC 6 News.
Jackie, thank you. We still have a lot to cover. Coming up next, addicts posing as potential home buyers, but they're really there to steal your prescriptions. What realtors say you need to do to keep your medicine safe.
Here in Franklin County, we're seeing about 85% of the overdose deaths are fentanyl related. Most of the deaths have multi-drug causes, but fentanyl is the one commonality in about 85% of them.
If you're considering selling your home, be prepared for people to come to your open house for the wrong reason. Those who are addicted know that homes on the market can be a pretty easy target for prescription drugs. And as Jackie Orozco tells us, there's an easy way you can keep your prescriptions out of the wrong hands.
The Ohio Realtor Association is on a mission to prevent opioid misuse. In fact, they've already distributed more than 6,000 of these bags to help people properly dispose of their old medicine.
Expired 5/10 of 18.
Chris Reese is the president of the Ohio Realtors Association, and she's showing us some old medicine that needs to be thrown out, but in a safe way.
We have had reports where buyers will come into open houses and just start looking around, just start opening medicine cabinets. And so we think it's very important to educate our sellers from day one.
The association is partnering with the Ohio Opioid Education Alliance to get the word out. But you'd be surprised how many potential buyers actually want to raid your medicine cabinets instead.
A woman had gone in the Columbus, Westerville area and was looking through medicine cabinets. It seemed like she knew right where to go, right what she was looking for.
That's why Reese says it's best to lock up your medicine if you plan on selling your house and allowing strangers to walk in. And with these nifty bags,
fill the pouch about halfway with warm water and wait 30 seconds. And then it dissolves all the medication in.
Disposing old medicine is easier than ever.
That it's time to get rid of these unwanted drugs and dispose of them safely.
In Columbus, Jackie Orozco, ABC 6 News.
Anyone struggling with addiction knows how hard it can be to find a job. Well, one CEO who is all about second chances gives former felons who are fighting this disease an opportunity for a new beginning. Jackie Orozco tells us the story.
It's a great feeling. I take a lot of pride in my work.
Amy Grambo works at a demolition company called 180 Demo. She was hired right after serving a second prison sentence for her drug addiction.
I actually prayed to God that something happened because it's not something I wanted to do. And I was sick of it. And then as soon as I got out of prison, my dad had introduced me to John Rush, and I've been with John ever since.
John Rush is the CEO of 180 Demo, and he's all about second chances. All of his employees are former felons.
There's a concern for risk, and they're afraid if they hire somebody that's had a challenge in their past that they're going to see something tragic happen. And for us, the reverse has been true.
Having a stable job has kept Grambo clean, 7 years sober now. She's even been promoted at 180 Demo because of her hard work, making her the only female supervisor on the team.
Sometimes it's challenging working with men, but I love it. I absolutely love it, and I wouldn't trade it for anything.
That's exactly what Ohio lawmakers want other companies to do too. And to help, new legislation was introduced called the Comprehensive Ohio Drug Addiction Solution. It'll provide grants to employers who hire former addicts getting out of prisons. John Rush says everything helps.
Retention is huge, and support services, partnering with organizations in the community that provide counseling, mental health support, all of those, those are the things that are going to make companies successful.
And for Grambo, it's been a life changer.
You have a sense of accomplishment at the end of the day.
In Columbus, Jackie Orozco, ABC 6 News.
Coming up next, if you or a loved one is fighting a drug addiction, know that hope is not lost. Hear about a man who was close to death and made the incredible decision to change his life around, how he started recruiting others to make the same change after the break.
The pandemic has given us an opportunity to really be creative and expansive and build on work that was already underway. We're seeing a lot more availability of naloxone, which is an overdose reversal drug for opiates, and of medication to assist with treatment. So to help people with their cravings and their relapse with opiates as well. The availability of that is much greater now than it was previously.
Even during the pandemic, health departments are working to make sure naloxone can still reach people in need. They're using the mail. Once again, here's Jackie Orozco.
The kits come in this really awesome Project Dawn bag. Dawn stands for Deaths Avoided with Naloxone.
Casey Pidcock works at the Licking County Health Department. It's actually one of the first counties in the state to start mailing naloxone to patients.
We have been mailing naloxone to patients since 2016. The whole reason that we started a mail order program is we saw really three barriers. Lack of transportation was a big one. Another one was lack of time commitment. And another one would be lack of being anonymous.
She says during the pandemic, having one of these kits is more important than ever.
It's the first line of defense when it comes to an opioid overdose.
The mail-in program is a quick and easy process. All you have to do is go to harmreductionohio.org. It takes you to this webpage. Then you press order here. It takes you to a quick little training, and then you get your naloxone through the mail.
We want to make sure that people who need access to this life-saving drug have the access to this drug, regardless of whether they have a prescription.
This is 4 milligram nasal spray. You're actually going to get 2 in every single box.
At $80 each, those kits aren't cheap, but thanks to the Ohio Department of Health, it's free. And now other counties around the state are starting the mail-in program too.
We've got to know a lot of different counties, and they've actually reached out to us in hopes that we could provide them a little bit of information and guidance on how to implement their own naloxone mailing program.
In Columbus, Jackie Orozco, ABC 6 News.
A homeless man struggling with addiction hits rock bottom after the death of his mother. But with a little help from a friend, he had enough strength to overcome the powerful disease of addiction. Jackie Orozco has his compelling story.
Jeff Anastasia has struggled with drugs and alcohol for years.
5 years ago, I had nothing. My wife was homeless, and we just had a trash bag of clothes.
He says he was at his wit's end, in and out of jail, and loved ones giving up on him.
I've got 56 misdemeanors, 7 DUIs, 6 felonies, and 16 driver suspensions. That's all I used to know was jails and institutions.
Then he hit rock bottom.
My mom died in 2011. She overdosed on Xanax and Oxycontin. So I was just tired of my life where I just wanted to die.
Until a friend got him some help, he spent months at Mary Haven, House of Hope, and a sober house.
I took 14 months just to work on myself.
He started attending Alcoholics Anonymous meetings regularly, and now he helps recruit more members.
It's the biggest part of my sobriety today, staying busy and helping others.
Making everlasting friendships during these meetings.
All they've seen is the Zoom meetings.
But with COVID, meetings are now small or moved online,
we're having meetings,
like Facebook.
But we're also putting them on live Facebook too at the same time. So if you don't feel comfortable going to the meeting, you can actually just sit there and watch it on Facebook Live too.
He says going to church helps too. Even as people social distance, wear masks, you can still get that in-person connection. Anastasia says the first step and the hardest step is just asking for help.
And that's what the meetings are for. They're for fellowship, for us all to come together and hang out, talk. But obviously with this situation going on, if you can't find a meeting or a meeting is full, pick up that phone, reach out. You know, somebody will come pick you up.
Like, there's guys that have been in there for months that have never been to a meeting.
In Grove Port, Jackie Orozco, ABC 6 News.
Jackie, thanks. Don't forget, we have an entire section on the ABC6 website dedicated to stopping addiction. Just search using the keywords Healing Together. And if you have questions about addiction, visit don'tliveinDenial.org. I'm Adam Slinger. Thanks for watching.